Dr. Ken Landau. Thanks for watching. Let's talk about Provigil or Modafinil. This drug was first approved by the Food and Drug Administration in 1998 as a treatment for narcolepsy. And then in 2003, the indications were extended to cover the sleep abnormalities associated with night shifts or rotating work shifts, and also for the excessive daytime sleepiness associated with obstructive sleep apnea, but not as a treatment for the sleep apnea itself. The drug went generic in 2012, but because of skin reactions and hypersensitivity reactions, serious adverse reactions, the European Medicines Association, which is the equivalent of the FDA in Europe, they said the new prescriptions for the drug should be limited to people who suffer from sleepiness due to narcolepsy. The drug seems to promote wakefulness. It provides certain cognitive benefits to the human brain. It stimulates the central nervous system. And that means that students, unfortunately, misuse the drug. Adolescents misuse the drug for increasing their attention span or increasing their concentration. But the drug is not approved for any pediatric or adolescent population. It is not approved for attention deficit hyperactivity disorder, in spite of the fact that it's widely used for that condition. Unfortunately, in the pediatric population extending up to age 18, it has an increased likelihood of causing very serious side effects, so should not be used. The Drug Enforcement Administration considers the drug a Schedule IV compound in the same classification as Valium or Xanax or Restoril or Soma. Appropriate dose, if you're taking it for narcolepsy, is 200 milligrams first thing in the morning. On the other hand, there's no evidence that 200 milligrams works any better than 100 milligrams. If you have the sleep-wake disorder, it's suggested that a dose of 200 milligrams taken about an hour before the start of your shift, that's most appropriate. Now, the United States and the United Kingdom and India and France, the armed services in those areas, believe that the drug is useful for people in combat situations during lengthy missions where sleep deprivation is going to be associated with the mission. And in 2012, the Air Force said pilots should use it rather than dextroamphetamine that had previously been used for those missions that were going to take a long time or combat purposes. And now astronauts can use the medication. Well, it's not recommended if you happen to suffer from certain arrhythmias, if you have significant hypertension, if the muscle in the left side of the heart, the main pumping chamber, is enlarged, we call it left ventricular hypertrophy, then you shouldn't take the medicine. And there's a question about any drug that affects the central nervous system. Could it cause functional impairment? Well, we don't really think so, but because it might affect judgment and thinking and motor skills, at least when you start to take the pill, should be cautious about undertaking any hazardous activity like driving a car. The medicine may cause serious reactions, serious skin rashes that can lead to death, can cause anaphylaxis, angioedema, and hives and swelling of the face and the tongue, and bronchospasm, difficulty breathing, and difficulty swallowing. About 2 weeks after starting the medicine, some people develop a hypersensitivity reaction that's associated with drug fever, associated with a skin rash that's all over the body, associated with inflammation of the heart, inflammation of the liver, decreased white blood count, decreased platelet count, might impair a person's mental state, so especially in people who have a history of psychosis, mania, depression, hallucinations or delusions or suicidal ideations. People who are aggressive or agitated or confused, better stay away from the drug. And if you have a history of cardiovascular disease, you need increased monitoring, and again, not appropriate for people who have enlargement of the left portion of the heart, the muscle of the heart, the left ventricular hyperplasia, or people who have mitral valve prolapse syndrome. And the drug can alter the metabolism of a variety of other drugs. So it increases the metabolism of the opioids. So if you happen to be taking hydrocodone or oxycodone or fentanyl, those medicines aren't going to work as well and might even suffer from withdrawal reactions to them if you add the Provigil or the Modafinil. And additionally, if you happen to be taking a contraceptive, well, it's going to interfere with the effectiveness of the contraceptive because it's going to increase the metabolism of the component parts. So you have to be very careful, and you should be careful for even a month after you discontinue the drug. And it will also decrease the concentration of the atypical antipsychotics, drugs like Seroquel. And if you happen to be taking a sleeping pill like Halcion, going to decrease its effectiveness. On the other hand, it can increase the concentration in the system of the tricyclic antidepressants like amitriptyline or the selective serotonin reuptake inhibitors like Prozac or Paxil, increase the amount of propranolol, a beta blocker in the system, or Valium or Dilantin, phenytoin, increase the amount of Nexium in the system, and it can alter the amount of warfarin or Coumadin in the system. Now, the medicine consists of two enantiomers, an R and an S. They're mirror images. That was Provigil or Modafinil. So the company got the great idea. What they could do is they could get rid of the enantiomer that didn't seem to provide all that much function, and then they would get another patent, and then they would have an extended use of the drug. They named that Nuvigil or R-Modafinil. That's just the R enantiomer. Well, the side effects associated with the medicine, yeah, there are a lot of them. Headaches are extraordinarily common, about a third of the people taking the drug. Nausea in about 1 in 6 or 7 people taking the pill. Then the pill can also cause anxiety and jitteriness and irritability, cause agitation and gastrointestinal distress. And some people cause dizziness. And about 1 in 12 people discontinued the medicine because of side effects. Now, in 2007, the company was manufacturing the drug at that time known as Cephalon. They were ordered to modify the leaflet that comes with the medicine and to put a bold-faced warning on that the medicine could cause serious and potentially fatal rashes known as Stevens-Johnson syndrome, toxic epidermal necrolysis, could cause hallucinations and angioedema, and typically it did that in people who were less than age 17. Now, Teva, the Israeli company, bought Cephalon, and they discovered in mid-2019 that pregnancies associated with the drug could lead to significant congenital abnormalities, and that led Health Canada in June of 2019 to warn women not to take the medicine if they could become pregnant if they were not taking appropriate precautions, appropriate birth control. Modafinil is associated with major fetal congenital malformations, including cardiac malformations. About 17% of women, especially in the first trimester, going to have fetal abnormalities associated with the pregnancy. So obviously not a good idea. And additionally, we know that you need a pregnancy test about a week before you start the medicine, and you need to be taking contraceptive while you're on therapy. However, the birth control pill, the IUD, and the patches and the implants don't work nearly as well when you take the modafinil because they're going to be metabolized at an increased rate. As far as breastfeeding is concerned, probably also not a good idea. In the pediatric population up to age 18, not a good idea because it can lead to a higher incidence of serious rash and Tourette syndrome, actually lead to insomnia and hostility and cataplexy and suicidal ideations. And remember, it's not approved for attention deficit hyperactivity disorder. If you happen to be an elderly individual over age 65, then you should start off at a lower dose. That would be much more prudent. We know that there's no evidence of tolerance or withdrawal reactions associated with the medicine, but it might have some addictive potential, especially in those individuals who seem to have been addicted to other substances. So in studies in the laboratory, we find that monkeys who are self-trained to self-administer cocaine, those monkeys would self-administer the modafinil. Well, the bioavailability of the medicine is more than 80%. 60% is going to be protein bound. The peak in the serum is going to be in about 2 to 4 hours after you take it. Food is going to slow the absorption by about an hour, but it doesn't change the total concentration in the bloodstream. The initial half-life when you take one pill is about 10 to 12 hours, but after multiple doses, after 2 to 4 days, the half-life is extended to about 15 hours. It's metabolized in the liver and excreted in the urine. You have to be careful if you have liver or kidney disorders. There are two metabolites of the medicine. One is known as modafinil acid, the other modafinil sulfone. Both of them are inactive as far as wakefulness is concerned, but the modafinil sulfone has some anti-convulsant activity, anti-epileptic activity. The way the medicine works is it seems to increase the amount of dopamine and noradrenaline or norepinephrine in the brain between the nerve cells, in the synapses. Also increases the amount of serotonin, and seems to indirectly increase the amount of glutamate and orexin and histamine, while it downregulates the amount of gamma-aminobenzoic acid, or GABA. It binds to the same binding sites on the dopamine transporter as cocaine, but it works in a different manner than both cocaine and Ritalin. If a person were to take the medicine, the modafinil, and then take Haldol, it would not be altered. The activity of the modafinil is not altered. On the other hand, if you happen to be taking the other kind of medicines, the amphetamine medicines, they would be inhibited by the Haldol. Interestingly, if a person takes a medicine that's usually used for benign prostatic enlargement, medicine known as prazosin, that's an alpha-1 adrenergic antagonist that will antagonize the activity of the modafinil, the new Vigil. Well, it seems that the medicine increases the blood flow to the areas of the brain that seem to be involved in cognition and learning. So how does the medicine work? In narcolepsy, is it really a good choice? Well, in narcolepsy, you have a tendency to fall asleep very quickly, suddenly, unexpectedly. So what we would like to do is we'd like to perform a test to see how long you can maintain your wakefulness. So we sit you in a dark room and we just wait. A normal person can stay awake for at least 8 minutes. In narcolepsy, oftentimes it's only going to be about 6 minutes. Well, when you take the 200 milligrams of the modafinil, it's going to increase the amount of time you can stay awake by about 2 or 2.5 minutes. On the other hand, if you take a placebo, it's not going to really significantly change, might even decrease the amount of time you stay awake. Now, modafinil is considered probably adequate for maybe 50 or 60% of the people who have narcolepsy. The other individuals need some sort of additional therapy, need some sort of a stimulant. Now people are using the Xyrem. Xyrem is the date rape drug, and that can cause a significant number of side effects and is horrendously expensive. Well, unfortunately, when you take the modafinil, it doesn't change the cataplexy or other core symptoms associated with the narcolepsy. Second choice therapy would be the Ritalin or the Adderall. Third choice would be the Dexedrine. Now there's some new medicines that came on the market in 2019. One of them is known as Sunosi and the other one is known as Wakesix. Those two medicines seem to have some role. The Sunosi is labeled by the DEA as a scheduled drug or controlled substance. The Wakesix is not. If a person has obstructive sleep apnea, does the medicine work? Well, again, obstructive sleep apnea associated with loud snoring and waking up at night because of interrupted breathing. The favored treatment, of course, is lose some weight and use a CPAP machine, but they have an Epworth sleepiness scale. And on baseline, the average in people who have obstructive sleep apnea is about 14 points. If you take the modafinil, you decrease it by about 4 to 5 points. Significant difference would be even if it were dropped by about 2 points. Seems to be in a placebo therapy, drops by about 2 points. But on the other hand, if you have obstructive sleep apnea and you improve the daytime sleepiness a little bit with the modafinil, you still require at least 4 hours of the CPAP for 3/4 of the nights. And if we measure on the sleep machines how your sleep is doing, it's not going to be changed. Well, if we look at obstructive sleep apnea and see how long you can maintain your wakefulness, the baseline in those individuals is about 13 minutes. And if we use the modafinil, we can increase it by about 1.5 minutes. On the other hand, placebo would decrease by about 1.5 minutes. And on the shift work, the rotating shift work, yes, it seems to be a little bit helpful. We find that people who are on rotating shifts, they have severe problems as far as what we call the MSLP. That's the multiple sleep latency test. What we do is we put the person in the room and we see how fast they fall asleep. The faster you fall asleep, the more likely you are to have, obviously, some sort of a sleep abnormality. So, in people, normally it takes them 15, 20 minutes to fall asleep. It's troublesome when it takes you only 5 or 10 minutes to fall asleep. And you have severe problems if you fall asleep in less than 5 minutes. Well, in people who are taking these multiple shifts, who have significant problem with their sleep, they might fall asleep in 2 minutes on this multiple sleep latency test. It's going to be improved by about 1.5 minutes with the modafinil, and no significant change with placebo. Well, over a period of time, over the period of the past several decades, there's been a marked increase in the use of the drug. It's increased by about 3-fold for FDA-approved indications. On the other hand, its use has increased by more than 1,500% for off-label indications, for use as a cognitive enhancing drug. It helps people do what they say needs to be done without becoming jittery, and even though they're suffering from sleeplessness because they have to work extra hard. And it doesn't have the addictive potential of some of the stimulants. So all that's good. But unfortunately, we find that it's not as good as people think. Well, what kinds of disorders is it used for outside of the indicated disorders? Well, it's used for the fatigue and lethargy that comes along with neurologic disorders, with multiple sclerosis or Parkinson's disease, or fatigue that's related to cancer or cancer chemotherapy. It's used for schizophrenia and bipolar disorder, chronic fatigue syndrome. People who are depressed, it's used for attention deficit hyperactivity disorder, used to counteract the sleepiness that's associated with neuroleptics, the drugs like the Seroquel or the Zyprexa, used for cocaine addiction, used for the post-chemotherapy cognitive impairment, used for fatigue, used for mood disorders. Especially used in people who are taking antidepressants or benzodiazepines, even people who are taking the amphetamines. And as a matter of fact, one study looking at people who were taking modafinil, about half of them were taking antidepressants, about 15% of them, in other words, about 1 in 6 or 7 taking the benzodiazepine, the tranquilizer, and about 1 in 16 taking amphetamines. Well, the drug has gotten the label as being a smart pill because supposedly it increases the attention and executive function, increases the learning in your decision making, in your planning, in your flexibility in thinking, and you're feeling focused, and you don't have any crashes that are associated with withdrawal from the stimulants. The idea is you have to be competitive in this world, you have to be your very best, you have to be the best performer on your team. It's used as a brain booster by students before examinations. If you're studying to write your term paper, used by truck drivers who are driving long distances, people who are working on deadlines, and pilots and emergency room doctors, and people who are engaged in competitive trades, because it supposedly increases your focus, but unfortunately sometimes it increases the focus on the wrong thing, and of course can interfere with sleep, decrease your appetite, and can actually decrease your short-term memory even though it increases your ability to concentrate. And while it can decrease your need for sleep, sleep does perform a very essential task in the body. How does it compare to other supposed brain boosters like caffeine or nicotine or Ritalin or Adderall or L-Dopa? Well, actually, when they're studied, they all seem to be relatively about the same. So yes, indeed, those substances can increase your short-term memory, your working memory, the retention memory, your planning, your attention, maybe increase your reaction time and your logical reasoning and your mental flexibility. But the benefit is very small. It's not studied for healthy people. The medicines are used for people who have diseases, and certainly if you don't have a disease, you probably shouldn't take these kind of medicines that have been popularized for off-label use on the internet and bloggers and podcasters. Some people consider it Viagra for the brain. People think it's like brain doping. You feel the same kind of benefit as you would if you were taking Adderall, but you don't have the speediness. And a lot of people are making purchases on the internet without any prescription. Well, let's look at how people who are taking the caffeine or the Ritalin or the Modafinil do compared to placebo in a chess match. Well, actually, the people who are taking the placebo play much more rapidly. They play an average chess match in about 430 seconds, as opposed to about 530 to 550 seconds if you're on caffeine, Ritalin, or Modafinil. And if we time out the game after 15 minutes, we find that a significant number of people are going to time out if they're taking the caffeine or the Modafinil or the Ritalin, versus very few people going to time out if they happen to be taking a placebo. Most of the people taking the placebo going to get done with their games relatively quickly. Well, Modafinil was developed in the early 1970s in France, and it was actually first approved in France in 1986 as Adrafinil. It was voluntarily discontinued in 2011 because it was found that Adrafinil was metabolized into Modafinil. Modafinil was approved in France in 1994. Cephalon bought the rights from the company that first made it, and then Cephalon was purchased by Teva Pharmaceuticals. And then Teva came out with Vigil, that's just the R enantiomer, as I mentioned before. Along the way, they've had an awful lot of settlements with the government for some bad actions, well over $1 billion in fines, and then they had some problems with pay for delay. They were paying other companies not to bring out drugs that might compete with it. How much does the Modafinil cost? Well, 200 milligrams, if you get 30 of them, the cash price would be $740 to $900 for a month worth. If you have a coupon, you could go to Costco or Walmart, get the same thing for less than $40. But if you go to CVS, it'll be $108. If you go to Walgreens, it's going to be $305 for the same thing. If you wanted the brand name, if you wanted to buy the Provigil, even if you had a coupon, the cost of the drug would be somewhere between $1,700 and $1,800 just for a month. Now, on the other hand, Vigil, just the R isomer or R enantiomer, the cash price of that is about mid-$500. If you have the coupon, somewhere between $30 and $50. CVS, it's about $120. At Walgreens, it's about $200. And if you get the brand name, it's somewhere around $800 to $900. So Modafinil or Provigil, it's a medicine that can help people who have excessive daytime sleepiness for narcolepsy or obstructive sleep apnea or rotating shift, but it's mostly used off-label. Yes, it can indeed postpone your need to go to sleep. It can make your focus somewhat better, but the real question is, does the hype live up to reality? And the answer is really not so clear. While it can get you focused on a task, you might focus on the wrong task, and it might actually slow down your activities. And yes, if you decrease sleep, you can work a little bit longer. But the question is, what is the function of sleep? And if you try to avoid sleep for a certain period of time, for a significant period of time, it will definitely, just the lack of sleep, has abnormal reactivity on the brain. And the price of the drug, the list price of the drug, absolutely ridiculous. So anyway, now you know the story. Thank you for watching. If you enjoyed the show, please tell a friend, maybe consider subscribing. As always, we appreciate your interest. I'm Dr. Ken Landau.